Hello, everyone, and welcome. My name is Eric White. I'm Executive Vice President of Business Development with Brosnan Risk Consultants. Welcome to our Pandemic Threat Intelligence Briefing. I'm joined today for this briefing by two of my esteemed colleagues. First, I'd like to introduce Dr. Robert Darling. Dr. Darling's credentials in the military and medicine with a specialty in infectious disease are extraordinarily relevant today. Dr. Darling was the first board certified emergency medicine physician to serve the President of the United States as White House physician. Dr. Darling served President Clinton, Vice President Gore, their families, and other presidential support units in the White House, Camp David, and various other classified emergency location facilities. Dr. Darling played a key role in the development of top secret emergency contingency plans designated to mitigate threats to the continuity of the presidency. You'll hear a lot from Dr. Darling today as we discuss the COVID-19 pandemic. You'll also hear from another colleague of mine, Brian Parman, who is our Chief Intelligence Officer at Brosnan Risk. Brian is a retired senior executive with the FBI, has subject matter expertise, extensive networks and leadership experience in both the criminal and national security matters. He is an experienced crisis manager at the national level and was former special agent in charge for New York Joint Terrorism Task Force and the FBI New York Counterterrorism Divisions. Gentlemen, thank you for joining me today. If you would, Brian, would you start with an overview brief from a threat intelligence standpoint and let our viewers know from your perspective, what are we looking at today in our COVID-19 environment? As you know, life is different. We're working from home, businesses are closed, our kids are taking school at home, and those businesses that aren't closed have absolutely different procedures in place than they did before. Brian, what are the criminal trends and the threats and risks that you want to present to our viewers today?
Eric, I appreciate the kind introduction, and I'm so grateful to be here to talk about it. As you know, this crisis has significantly altered the threat landscape. Today, as we look at it, we've crested the 10,000 death mortality rate. Businesses are shuttering, stress is high, hospitals are reaching saturation point. Truly, we're in uncharted waters. From an intelligence aspect, what I wanted to talk to you about today was four main topics. Really, personal and property crime, the potential for cyber crime, the potential for international and domestic terrorism and potentially active shooter scenarios, and social unrest. Starting off with personal and property crime. What we're seeing across the nation is a drop in social crime. That is assaults, murders, narcotics trafficking, things that require people to get together. But what we are seeing is a significant spike in burglary, theft, and vandalism. I think that with the economy, with the stress that's on the economy, with the loss of jobs, with police conserving their resources and reallocating them and trying to keep their own forces healthy, we're coming together in a perfect climate for crime to occur. Obviously, all of these stressors correlate to a rise in the crime that I've already talked about. We have seen instances of individuals exploiting the current COVID crisis in order to gain access to items of value. Specifically, some examples are individuals posing as service personnel, gaining access to ATMs to empty or remove those machines. We've seen individuals posing as healthcare workers or cleaning crews in order to gain access to personal space and steal items of value. We believe that as this crisis continues and people become more stressed and their ability to access finances becomes stretched, their desire to meet their basic needs may result and will continue to result in a rise in burglary, theft, and vandalism. Secondly, we see a real potential, and what we're seeing is a rise in cyber and the online platform to increase space in the virtual world. With shelter in place, travel restrictions, and remote work uh, uh, edicts, more and more people are online, and that's where people are going in order to take advantage of these people. Um, Examples of what we're seeing are posting false data links so that people will click on those and the cyber criminals are able to install malware. We're seeing a lot of phishing attempts against individuals, hoping that they'll click on an attachment so that the cyber criminals can compromise business email. Um, we're also seeing increased scams avoiding the sale of COVID medical equipment and personal protective environment. And finally, charity scams. We're seeing a lot of individuals out there encouraging people to donate money and then contacting them so that they can steal their PII or personal identifying information. Um, while we are in this phase, we assess that you will continue to see a rise in these types of crimes um, because, as Willie Sutton said, when asked, why do you rob banks? It's because that's where the money is. Right now, we are all in a virtual world, and that's where we're going to see criminals going after. Finally, international and domestic terrorism. Uh, well, not finally, but there is we are seeing some trends towards misguided or individuals led by misguided and radical beliefs trying to exploit this crisis. ISIS has publicly called on their followers to attack hospitals and critical infrastructure. We're also seeing racially motivated violent extremists talk online about potentially utilizing the fluids of infected members and put them in spray bottles and trying to weaponize these sorts of things, uh, weaponize the COVID crisis. These individuals will continue to do this in order to further their own misguided agendas and take advantage of the COVID crisis to put forth their incite violence, intimidate targets, and promote their ideologies. Now, finally, we have to look at the potential for social unrest. Uh, Economic growth and the unemployment rate are two of the most important indicators of social unrest. Longer term economic damage from this pandemic is yet to fully unfold. Um, as we see the cases continue to multiply, stress care on the healthcare system increase, mortality rates increase, and people's access to money to meet their basic needs, and governments to provide essential services, the potential for social unrest becomes much, much greater. If we take other areas just to our south in Mexico, we're seeing a large potential for social unrest as people organize online uh, looting campaigns against various shops and businesses. All in all, it's not a good outlook the longer this continues, but these are all potential areas and crime trends that we are seeing in the current situation. With that, I'll kick it back to you, Eric.
Thank you, Brian. We'll go to Dr. Darling next, but we'll come back to you with some questions that we've had come in on your topic, Brian. Dr. Darling, to you, the media is full daily. We hear the 24-hour news cycle is medical experts talking to us about COVID-19. We hear the White House pandemic panel led by the vice president addressing us daily. in almost every state, governors have daily addresses. Medical experts abound. It sometimes can be confusing. As a medical professional with the years of experience that you have, how do you picture where we're at today, and what are some of the important topics you think our viewers need to hear?
Sure, Eric. Look, we have not faced something like this truly since the Spanish flu in 1918, okay? Obviously, a worldwide pandemic. We have a situation now, it's difficult for everybody, including decision makers. Everybody wants an answer. They want an answer to all their questions. But for some of the questions that are being asked, there isn't an answer right now. But when you give an answer such as, you really can't say, I don't know. What we have to do is we have to take the best available information and give the best answer, the most accurate answer based upon currently available data. I mean, that changes. For example, it wasn't even 2 weeks ago that the Surgeon General, who's a great guy, Dr. Adams, said, the regular public shouldn't be wearing, no reason to wear masks. It's a waste of time. Maybe not a waste of time, but something akin to that. And we've subsequently rethought that, or at least the folks at CDC. And there are certain indications where we'll consider having people, wear masks in public. Now, we're not advocating everybody get an N95 and take it away from healthcare workers, but some sort of improvised mask may have some positive effect on reducing transmission of the virus for a lot of reasons that we can go into. But yeah, I mean, we're going to get through this. I'd just like to emphasize, I think we have to really do put this into perspective. 99% of people that get this virus do fine. Some get no symptoms at all. They get infected, they get no symptoms, or they may get mild symptoms, but the vast majority recover. It's that 1%, right, that we're looking at. And this is a highly contagious virus. The world hasn't seen it before, right? So there's no, what we call herd immunity going on. So again, I should also emphasize too that every year, 30 to 80,000 Americans die from influenza. So anyway, perspective, we're going to get through this. Turn it back to you, Eric.
Thanks, Dr. Darling. You mentioned something that I think is really important to folks. People understanding how to stay safe. You mentioned that the guidance from our national leaders had evolved. At first we were hearing things like washing your hands is critically important, social distancing critically important, which had a connotation that this disease was transmitted via surfaces and could live for a period of time on the surfaces. And then as that guidance evolved, to your point, to wear masks, people are understanding that by wearing a mask, I'm protecting the transmission. The encouragement is the public doesn't need N95 masks, that they can build cloth masks from home. And that, if I'm understanding that intent right, it's to prevent the transmission from potentially myself, an asymptomatic carrier, to someone who could potentially contract the disease and have symptoms from it. So if you would talk a little bit about the transmission lines and what it means, and just maybe help our viewers understand, what does it mean if I see someone in a mask as I'm out today? Because I've never seen that before.
Right. Well, so all of those things, the hand washing, the social distancing, right now, eventually we're never going to relax the hand washing. That's always a good practice, but the social distancing. But look, this is evolving too, about how this is actually transmitted. And let me explain. We know for certain, right? People who cough or sneeze, big droplets come out. I mean, the virus is inside there, okay? And that's typically those that's a 6 foot. That's why we talk about the so-called 6 foot. Okay, but if you sneeze onto your hand and then you go, you wipe your nose and you go out the door and you turn the doorknob. Okay, surfaces like that, the data shows that the virus can actually remain viable for up to 3 days. There's also evidence to show that on others, on porous surfaces, not shiny, maybe 12, 24 hours on cardboard. Okay, the somewhat worrisome, but we don't know yet, is can it be transmitted via what we call like a fine particle aerosol? In other words, if those droplets, and we're not certain yet, but if those droplets, when they dry out and desiccate, there's some evidence to say that the virus can aerosolize, almost maybe be like act like a gas, right? So maybe further on, probably if that is a method of transmission, it's probably low. We don't know for certain right now. It's something when I was on active duty and I was working at Fort Detrick at the biological weapons. That was sort of the nightmarish scenario. We always kind of thought, an infectious agent that could truly pass via an aerosol. It just makes it more difficult, right? But again, we're going to know a lot more about these things in the coming weeks as the researchers are ramped up like you wouldn't believe.
Thank you, Dr. Darling. Another topic that may not be in the emergency medicine space, but it is emerging quite often, quite frequently recently, and just in recent days. Brian mentioned that there was a reduction in interpersonal crimes in some locations. But we're also seeing a bit of a concern and maybe a spike in some cases with mental health concerns as people are sheltered in place in their homes for a long period of time. And look, I don't mean the kind where you have 3 or 4 kids that are in elementary school and your house is in chaos and you're trying to work from home and your spouse is trying to work from home and it's chaotic. I mean the mental health kind where people are actually suffering and maybe acting out of character, and there are increases in domestic violence. For our companies, for our viewers that are in companies, give us some perspective about hotlines, the ability for people to have an outlet for that.
So Eric, great point. Look, we're all doing this right now. We all know the stresses, and mental health issues are going to be exacerbated by this. The good news is there's good news out of this in that, I've been doing telemedicine for 12 years. I was doing it before people, what the heck is that? Or that's never going to take on. Well, let me tell you something. It's here to stay and it is going to multiply. And it's particularly effective in the mental health arena. Okay. When I was on active duty, we would take care of active duty soldiers, sailors, airmen, and Marines. They would get a one-on-one with a mental health professional via a secure video link in privacy. We were always about keep the mission going, keep the men and women who are fighting the battles up. And there's a stigma associated with mental health. We're trying to make that go away, but it's always going to be there. There are mental health professionals can see patients very, very effectively via telemedicine, and I hope to see when we're done with this, and we will get done with this, that that insurance companies will reimburse, and we'll see many, many more ways to take care of our mental health patients with mental health issues.
Thank you, Dr. Darling. I have one more question from our viewers for you, and then a couple for Brian as we wrap. We look at statistics around the world. There are countries that are ahead of us in fighting the virus. And we compare a lot of modeling based on the things that we know. And we've heard on a daily basis that the modeling is only as good as the data that goes into it. But America is a unique place. We're a unique culture, and we are forever optimistic. Our businesses want to get back open, Dr. Darling. Our people want to go back to work. The owners want to keep people employed, and we want our economy back where it was before. So if I'm a business owner and I'm sitting at home now, I may have my hands tied to some degree about when I can open. But what are the things I should be thinking about as the day comes when I can open my business? Should I be thinking about a staged recovery and how I let my employees back? We hear about herd immunity and the potential for maybe people who've contracted the virus and recovered now have some kind of immunity to it. Maybe they're the first back. Do I do simple things like, do I go into my office and move my cubicles farther apart? I mean, can you just help our business owners figure out what can I be thinking about? Because the day will come, America will rise again, but we want to get back to business.
Well, again, great prescient question. Everybody, every leader, so a number of things here. We're going to get back to work. We have to get back to work. In order for business owners and leaders to be able to do that, they really do, and I know they all are, got to get smart on this virus, right? Really understand it. A lot of these things, they have to, they can't rely too much on us. Everybody's got to get smart on this. And we do have to get back. We're going to be hearing a lot about it coming up. Vaccine's going to be around. It's going to be months away. I actually am one. I don't think it's going to be 18 months. I don't think it's going to be a year. I actually think we might get a good candidate vaccine before the end of the year. But short of that, remembering what I just told you, the vast majority of people who get infected with this, they do fine. Okay, and I am of the belief, look, we're going to go into a recession. We're in a recession, but we can't go into a depression. We can't have a repeat of 1929. So with that, we're going to have to understand the risk. There will be some risks as we relax some of the social distancing, but we'll do it smartly. Maybe one of these candidate drugs, I'm pretty confident that we're going to get good data on the anti-malarial drug, the hydroxychloroquine and the azithromycin. But I guess the crux is leaders have to do their best to understand this. We have to understand the risks and support the research. We have a bunch of mini Manhattan projects going on now throughout the world. It's unprecedented. Thank the internet, we have scientists, doctors, physicians, nurses all over the world collaborating, and we're going to have a big breakthrough soon. I don't know when it is. I don't know what it's going to be, but it's never been like it in the history of the world. What we have going on right now, this is top, front and center for everybody. So,
Dr. Darling, thank you very much. Your medical expertise, your years of experience, it just simply can't be replaced in an environment like we're in today. We so appreciate you taking the time to share some of your thoughts with our viewers. And at the end of our webinar, we'll let you know how you can, as a viewer, submit questions for our next session and interact with Brosnan Risk Controls on our website. So, Brian, we had a couple of questions come in for you, and I think I'll combine two of them into one. Businesses are boarded up in some cases. In some cases, businesses no one's going to, where typically there was people in them every day, if not 24 hours a day. And so given that there's empty buildings, which can be a lucrative target for people with bad intentions, we can just call them bad guys. So you have the target that's there. And then you mentioned earlier that police departments, law enforcement, first responders are all struggling with their own prioritizing of calls. They may have limited numbers of their own troops available for patrols in response. And so they're prioritizing their signals that come in, taking care of the most important ones. As a business owner, what are the things that I can be thinking about to help protect my building during this time?
Yeah, thank you, Eric. I think taking a common sense approach to this and talking about building security, we certainly have to consider making sure that the business is well lighted. Do you have security cameras? Is there remote monitoring of those security cameras? What about alarm sensors and monitoring? And do you have physical on-site security? All of those things would be common sense steps to make sure that your property is safe and secure in this coming environment. I would consider reducing or eliminating cash kept on hand. Talk about taking out cash drawers or petty cash, or even boxes where you're collecting money for other establishments. I'd remove all our client and staff personnel information that could be taken out of the file cabinet and used for identity theft. And I'd truly remove material around the exterior of the property, such as wood pallets, bricks, ladders, things, metal poles, anything that could be utilized to gain entry. And then finally, I'd seriously think about putting security film on the windows to prevent people from throwing rocks or other things through them and ensure glass integrity. I'd also take a look at putting astragals on the doors to make sure that they wouldn't be easily pried open. All of these common sense and all of these thoughts are something that as a store owner, where you're going to have a vacant building, but with valuables inside it, these are steps that you need to take to ensure that your property is safe during this crisis.
Thanks, Brian. That's really great advice. I think the common sense approach makes a lot of sense. As a last question, take that home for us. What I mean, Brian, is take that philosophy of what you do to protect your business to our homes. We're at home now. You heard your message about potential social unrest. We heard the message that criminals take advantage of the opportunity in times like this. And without being too much of a doomsday prepper sort of a mentality, but what are the smart things that we can be thinking about in our homes, Brian? Is it as simple as dusting off your family emergency plan and making sure your kids know where to go for a shelter in place or an evacuation plan? Just give us a sense of a couple things to think about in our home environment.
I mean, I think whether you're talking about a business or talking about your family, a lot of the planning and steps that you can take around that are dual use. I think that now is a great time to sit down with your family and talk about what is your emergency plan. Should something happen at the house, be that a fire or an incident? What is your evacuation route? Where are you all going to get together afterwards? Do you have emergency planning kits with, common sense items? Certainly there's been a run on toilet paper right now. I would consider water more important. I would consider, antiseptics. And, Dr. Darling can certainly talk about how you make homemade antiseptics towards this. First aid kit. Do you have things that, flashlights, batteries? Do you have common sense items like that in your emergency preparation kit? Does your family know about it? And then secondly, what's your call tree on that? If something bad should happen, who are you going to call, and where are those telephone numbers prominently posted so that anybody can get to that and anybody can call those numbers in sequence? I think practicing those things and talking about them with your family is vitally important during this time. I would, consider stocking those emergency preparedness kits in available locations. And I'd also take a look at, do you have a home alarm system, and does everybody have the codes to it? Is there anti-burglary items on your house, and have you practiced that? Those are all common sense steps, Eric.
Brian, thank you so much. For all of our viewers, thank you for staying with us through this broadcast. We look forward to the next time we see you. More information along with free intelligence briefs from the esteemed panel you saw today are available on our website And also, you can register questions for our next seminar if you'd like to on our website. Thank you all. Remember, in this time of challenge that we have, be safe. As importantly, be kind to one another. America will get through this. Thank you.